fascinating discussion about patient preferences here at ASCO 2014. And joining us to do that is Laura Havrilesky from Duke University Medical Center in North Carolina. Thanks for stopping by.
Thank you.
This is some pretty interesting work you're doing. What exactly are you doing in ovarian cancer?
So our group got very interested in looking at how women feel about their cancer treatment. And specifically, when you're having a discussion with your oncologist about a treatment for ovarian cancer, you're not just thinking about how long you're going to live, am I going to be cured of my cancer? You're also really thinking about what are the other considerations. And the considerations for women thinking about chemotherapy treatments for ovarian cancer range from everything from just the treatment schedule, how often you have to come in to see your doctor, how you're getting the chemo. Is it given IV? Are you taking it orally? Is it going into your body somewhere else? And the side effects of your treatment. And all of these can be, you can consider them harms or things that are really considered when choosing a treatment that have to be traded off against the benefits, which are the likelihood of cure and how long you're going to live without your cancer.
So in your poster presentation, what have you found that you're sharing here at ASCO?
Right. So we did a study where we basically asked women to look at two possible treatments for ovarian cancer in which we varied the characteristics of the treatment. So we said, for example, in one treatment scenario, you may have mild symptoms of nausea. In the other one, you may have moderate symptoms of nausea. In one scenario, you may have a little bit longer survival time until your cancer comes back, but you may have a less convenient regimen. You might have to come in to be treated more often. We had women look at those and do choices, make choices between two potential treatment options. Over and over, they did choices for 10 or 12 different scenarios. And when we did this with 100 different women and then tabulated all the data, we were able to say that first, women do care the most about survival time. That seems to be the most important aspect of treatment to them. And most of their choices are at least partially driven by how long they're going to live, which is very appropriate. But we also found that women are actually willing to trade some of that survival time in exchange for not having as severe symptoms of their treatment. So, we found that women would trade several months worth of survival time without cancer in order to avoid severe nausea, severe neuropathy, symptoms that would really possibly put them on additional medications or even put them in the hospital to treat the side effects. So I think it's just a valuable lesson in what trade-offs women are willing to make when they're making a treatment choice. And this is something that oncologists should be aware of and should be thinking about when they're counseling patients.
What do you do next when you get back to work on this?
So in this study, we enrolled a group of 100 women with ovarian cancer who were at any stage of their treatment. So they could have been in remission for 3 years, or they could be actively on chemotherapy when they were doing our study. What we'd like to do is get into groups of women that are more uniform. So do this same type of a study on women who have just been diagnosed, and they're all at the same point in their treatment, so that we can actually start collecting preferences that will inform not only kind of their decision about what treatment they want, but help to maybe predict how they may benefit or they may feel about their treatment after they've started it.
Congratulations on your work. Best of luck in the future.
Thank you.